Welcome to this episode of our DHHS podcast, Conversations to Creating a Healthy Community. And today, I am so honored to be joined by our very own Milwaukee County Chairwoman, Marcelia Nicholson-Bovell.
Hi, thank you for having me.
Are you excited to be here?
I'm so excited. I'm on an award-winning podcast, so I'm happy to be here.
Well, you're going to make it even more. I mean, we're probably going to win all the awards since you're here now, right? And then we're joined by Emily Kenney. Emily Kenney is our Strategic and Transformation Director for Department of Health and Human Services and done a lot of work around the food apartheid work. So I just want to thank you for joining us today.
Yeah, thanks for having me.
So today we're going to discuss the incredible work that you both are doing around food apartheid and food insecurity in Milwaukee County. A lot of this work has been led by our amazing chairwoman. So are you ready to get started to talk about it?
It's a very important topic.
It is a very important topic. So we're going to go ahead and get started. So the first question is actually for you, Chairwoman.
Okay.
And so last fall, there was an emergency situation where we had our Supplemental Nutrition Assistance Program, SNAP, also people know it as Food Share, right? There were some changes in Wisconsin. So those benefits, they were paused.
Right.
And you were like, wait a minute,
Yes.
right? What's going on? Yes. And so it was right before the holidays. So you put in a resolution, you work with the County Board of Supervisors, you work with the County Executive, David Crowley, and you appropriated $150,000 to Department of Health and Human Services. And this work was to get food right into the community, to the food pantries, to make sure that people did not go hungry, especially during the holidays, right? And so your focus was on fresh, nutritious food, right? You had some criteria for what you wanted to be out there. Tell us about how that jump-started the work that now you're leading around food apartheid.
Yeah, thank you. Great question. So I want to start by stating clearly that the work around food apartheid didn't start when I launched that resolution. It was already starting in our communities. We've seen several grocery stores over the last decade and more recently the last couple of years leave in succession, one after another with barely any notice.
Right.
And so that meant that folks didn't have access to fresh and healthy food. They would have to go to convenience stores. If they wanted quick food, they would have to travel on the bus, walk over 1.5 miles to get access to fresh and healthy food. So I started working with Metcalf Park Community Bridges around this language. How do we talk about what we originally saw as food deserts by naming it food apartheid?
Okay.
The reason why we name it food apartheid is because it is intentional. Food deserts are natural. Food apartheid is intentional disinvestment. We have these rumors around why grocery stores leave, and it's because of theft. The data shows that it's not true.
Right.
It follows redlining that we have saw historically in communities of color, where big profit machines don't invest in our communities. So they're leaving. And then at the same time, our federal government was at a gridlock around their budget. And they were holding SNAP, food nutrition, hostage in order to get those budgets and those bills passed. And so local government was talking about getting local food pantries to give food to our communities. And I thought, well, why don't we put our money where our mouth is? Why don't we do something about it?
Right.
We followed that food apartheid resolution with that allocation of $150,000 because I thought those funds should go right to the community, the people who are interfacing with our community members every single day.
Absolutely.
Know what they need. Those people trust them. And that effort was so successful. Your leadership here at DHHS helped to allocate those funds quickly so that people have fresh food on their table by Thanksgiving. And it served as a model now that other governments are following suit. So I know that was a lot of background and context, but it's important. Because if we don't know where we came from, we don't know where we're going. And I'm really hopeful about what's to come out of that work.
Yeah, no, I think we do need that background. And just a huge shout out to Metcalf, Melody McCurdy. She has been so critical and an asset to this work. And I know you've been working, like you talk about in partnership with her to talk about the language that we use and making sure that community is at the table, allowing them to lead the work. That's been really important for you. And tell us, why is that important that the community have a voice in this?
Because it's about them. I feel that the people who are closest to the problem are closest to the solution. And I'm one of those people. I grew up in the poor zip code in Milwaukee, in the state of Wisconsin, arguably the nation. And what informed my work today is the things that I experienced as a little girl in that zip code, things that my family and my friends experienced. And really it's about making sure that people who have been so impacted by disinvestment, by disenfranchisement, have the ability to solve the problems that are harming them. We know firsthand what is impacting us.
Right.
We know firsthand the reasons why. And so giving community the voice to make those solutions, one embeds, I think, those valuable solutions,
Right.
but also the trust and ownership that make those solutions sustainable.
Absolutely, absolutely. And I love that. Just the way that you're leading from like, nope, community focus, make sure they're at the table.
Yes.
And this is because you're right? They have to be a part of the solution for it to work. They have that buy-in. They know what works for them,
Exactly.
right? They know what's going to work and what's not going to work. So
Exactly.
like, why not have them there for the beginning? So I just love that you included them from when you were putting that resolution together, right? What does this look like? And how do we get that funding out to the community as quickly as possible?
Absolutely.
So we appreciate your leadership
Thank you
on
so
that.
much.
Absolutely. So, just another question. We think about Milwaukee County as a whole. We have approximately 230,000 people in Milwaukee County that are receiving food share, right? That's a lot of folks in Milwaukee County. And so this gives us an idea what the need is in our community, right? And yes, there's some pockets of our community where we have more folks, right? But when we think about the county as a whole, there's a lot of folks that are impacted, and I don't think we realize that. So let's talk about the need that you see firsthand. And this question goes to both of you. When we talk about, we were putting this, we had the money going to the community, and we had people show up. Even here, we had an event here at COGS. I mean, just the line that you see around the building, or the food pantries that were out there. Talk a little bit more about what that need looks like.
Yeah, so I can. It's been really eye-opening for me to work on this project, being able to get that $150,000 out the door to community agencies and continue to work with them. So we started monthly meetings in order to make sure that every agency had what they needed to for that project in November, and we've continued to meet monthly since then. And they continue to say, the need spiked, and it really hasn't gone down.
Right.
So even with our additional efforts, and even though the gridlock is done for now, in terms of the budget, there are still changes to SNAP and food share that are being rolled out this year that impact people's eligibility. And SNAP, while it does, it is the largest benefit and can help people actually use, grocery stores for food, pay for food. It doesn't make it through the whole month for many families. And so those food pantries are still seeing, even though people have their benefits from that gridlock, they still are seeing, pantries are seeing more and more people coming every month because it's just not going.
And I would just add that number, 230,000. That means it doesn't just exist in one ecosystem in Milwaukee. This is all across 4 corners of Milwaukee County. And if you do the math, that's almost 1 in 4 Milwaukee County residents don't have access to the funds to afford fresh and healthy food because, as you said, it's supplemental. That means that they need a little bit more. These are our seniors that we're talking about. These are our students. These are our mothers who are about to give birth. To our future residents. These are our children who are wanting to learn in school. And so this issue just compounds in so many ways in terms of health, in terms of education, in terms of economic mobility.
Absolutely.
Because food, I feel like, is the center of that. And so I hope people can really understand that 230,000 people is 230,000 too many.
I agree.
That need access to food.
And I think it's even more than that. I mean, I've been living in Brown Deer for about 15 years now. And so I remember my eldest son is now in his 20s, right? When he graduated from there, we didn't talk too much about like the need for food share, right? We now have a number of food pantries. And even at our school where we're, doing the food in the book backs for the children, right? We have volunteers who come and do that because a lot of our children are going home who may not have that access to the fresh food. And so just that need that you begin to see in all of our areas across the county, right? Sometimes it's like people have this stigma of who has food share, right? Who has it? But it is just, it is a lot of us, right? And we all, if you think about, we all are probably one paycheck away from maybe needing that. Like we need to make sure that we're just not thinking about it like, oh, it's just these people, right? Or this population. But it really does impact the county as a whole.
It does. It does. And it's so true because there are so many families who don't qualify for supplemental assistance. But as you said, they're one paycheck away because the cost of living has just exploded. We all see the gas prices,
the food prices,
the food prices, the cost of owning a home. I mean, it's just people can't afford the money is going shorter.
Absolutely.
So this issue, if we could, rise, I love the county executive. He's like a rising tides lift all boats.
Yeah,
and if we
absolutely.
could do that for our most vulnerable, then we can ensure that every single family across Milwaukee County has access to fresh
And if
foods.
we're doing that for them, right, it's a benefit for all of us,
Yes,
right? I think sometimes we
exactly.
think like if we're helping, those individuals who we call most vulnerable, right, or those things like that, like it's going to take away from us. But no, it makes it better for us, right? The impact for all of us, the benefits for all of us.
Exactly.
So that's why this work is so important.
So important. It's essential.
Yeah, absolutely. So, at Department of Health and Human Services, we talk about like everything we do is to improve the lives and the health of the people that we serve, that community health, right? Health and Human Services work with people,
yes,
right?
Yes.
Right. And so
it's a lifeline.
It's a lifeline. I love that, right? So how does the food apartheid affect community health outcomes over time?
Yeah. I believe food is healthcare. Right? So communities that don't have access to fresh, healthy foods, they have more risk of heart disease, high blood pressure, chronic illnesses. It impacts our seniors, their health, Alzheimer's. My grandmother passed away from Alzheimer's. Food can help or exacerbate positively or negatively how your mind works. Again, our maternal health, birth, how healthy a baby is born. Matters how well his mother was able to eat when they were carrying them.
Absolutely.
And if we want to be the healthiest county in the state of Wisconsin, we have to be serious about food and how we provide fresh, healthy, and culturally relevant food. Because we don't talk a lot about culture either.
Yeah.
I love the South Side because they have these great grocery stores like El Rey, where you can go, and we know Latinos love arroz and, different salsas and that sort of thing. Well, in communities on the North Side, we love soul food, right? So we need those collard greens. We need those turkey wings. We need that culturally relevant food so that people feel a sense of pride in their communities and what they're putting on the table, and that they have dignity every day.
Yeah, and that was one of the things we did with ARPA, that the board also helped us approve the culturally appropriate foods when we talk about like the dine-out sites, right? Having those restaurants in different, sides of the areas of community, right? Just to say, we need to meet people where they are and give them things they like to eat, right? We want to make sure they are fresh and healthy, make sure they enjoy eating it, right? And so that's really important. And I love how you connect those outcomes to maternal health, right? And children and older adults. And, some of my family members, my mom, my sister, they were dealing with diabetes, and my sister like, this is not reversible. She was just talking about like, she was just really stressed out, needing to give herself, shots and things, and young.
Right.
And so then she changed her whole diet, began to eat differently, more fresh foods. And she's off of all the medication she was on, right? Like feeling great, looking great,
looking
right?
good.
And so I think people don't realize that food really does have an impact. You talk about, we want to be the healthiest county. We need to change our behaviors and change our mindsets. But it's cheaper to eat junk food.
It is.
So let's talk. We need to talk about that, right? You go try to get a salad, you might be going to spend, $10, $15, but then you go get a cheeseburger and spend what?
$1, $2.
Right? We need to start thinking about how do we teach our community how to grow their own vegetables and fruit, and those are things we should be investing in.
And we live in the dairy land. We have so much agriculture across the state of Wisconsin. It really should be a no-brainer that we have a farm to table system.
Absolutely.
Or we shouldn't wait a day or two before we have, an abundance of food on our tables because we're growing it right in our backyards.
Yeah, I think that's our missed opportunity for the Cox. And I'm like, we should have had something on the root to grow some stuff.
Garden up there.
It's never too late. We should have figured something out. Right? But that whole growing, I'm like, I need to learn how to grow my own vegetables, right? So I need some teaching there too. Any thoughts about the outcomes, Emily?
Well, I think you talked a lot about the individual outcomes and also the empowerment and dignity of individuals. And I think about that with whole neighborhoods, especially when I think about apartheid, with the intentional disinvestment, re-empowering neighborhoods to be able to farm to table, get access directly to food, having local businesses in those neighborhoods, and really empowering them, empowers and makes the whole community healthier. So food, not only on an individual level, but I see that, and I'm learning about the impact that it has on entire communities. And there's really an opportunity to make communities healthier. And they're ready.
Yes.
They
they're ready.
already
They
know
are.
how.
Yes.
Just need the support to get there.
Absolutely.
Yeah, just hearing them speak about it, like it's like you all they have the solution.
Yes,
they
they
just need us
do.
behind them, just like to
Yes.
keep it going. Like it's
Yes.
so exciting to see, though, right?
It is.
It is like just our community showing up. Like you know what, you could go ahead, take the grocery store.
Yeah,
We gonna figure this out.
Yeah, we'll do it ourselves.
We do it ourselves.
That's what we want
right?
to do
Yeah.
anyway.
Yeah,
Yes.
absolutely right. So I love the work that's happening now, and just that momentum. We have to keep the momentum going,
Yes.
though, right? Sometimes we
Yes.
start things. It's like so. I'm really excited. And there's going to be some things that we talk about later about that momentum. When we think about the closures, you talked about this earlier. The closures of these grocery stores and last minute too, right?
So
Giving
last
us-
minute.
like giving us a day notice,
30
or
day, 1 day, one week.
Yes, like how does the limited access to fresh food affect? And you touched on this, but maybe we can go a little bit deeper. It affects our culture,
Yes.
and it affects our community identity,
Right.
What what do you think that?
Yeah.
Your
Yeah,
thoughts are
it's,
about?
like, grocery stores are food access, grocery stores, a store that has access to fresh, healthy food. It's so essential to a community because, again, it lends to the culture of what makes a community strong. No matter what language people speak, no matter what color skin they are, we love food.
We do.
And if I think about growing up, on the north side at my grandma's house, what did we do every single Sunday? We had a big old buffet on the
Greens,
table.
dressing.
Yes, greens, dressing,
Fried chicken.
baked chicken, caramel cake.
Yeah.
And it was all made from scratch, right? And so that grocery store being that cornerstone of that family foundation was so important to building community. And when we also think about grocery stores, we think about the economic impact of grocery stores, whether it's bringing a tax base to a community so that we can continue to invest in the revitalization of that neighborhood, whether it's jobs. One of my first jobs was at Pick and Save, right? So training our young people to go in and have ownership over their community, and having even our seniors being greeters at the door, giving them something to do when they're retired or maybe they've aged out of the workforce and need to be able to connect with their community members who are coming to shop. So it's so essential to not only the health but also the well-being of a community and the culture, the food aspect, the community building aspect, those events that help to bring us together, those barbecues, those block parties, those all need a grocery store to help make happen.
I agree, absolutely. Any thoughts about the community, the identity, things that we have there that you want to add, Emily?
Yeah, I mean, I think I agree. And I think making sure that there's an opportunity for some innovation and doing things in a way. So I think about, gardens within the city and how those, even farms that are close to the city and how we can leverage those resources and get youth working there directly, that kind of thing. So I agree. And I think there's a new era that we're about to unlock.
Yeah, I agree on the opportunity aspect, and we Milwaukee County, we partner with UW Extension, and so their Master Gardener program helps to train people how to grow fresh and healthy food. And I hear that someone from Milwaukee County will be starting as their director, and so already has ideas in how to engage us more and create more programming around fresh and healthy food access, so that people can learn how to have food in their backyard. But I also want, again, the economic impact. Growing it and having access to it in your backyard is awesome, but I want them to be able to sell it too. So is that access to markets? Is that more, a Sherman Phoenix model where people have,
I love that.
Right, a year-round ability, not just in the summertime, to sell their fresh produce? What can we do with land that Milwaukee County owns in order to give people access to growing fresh and healthy foods? And then how can we leverage our resources to also invest in more locally owned grocers, smaller local owned grocers that are more community based and neighborhood based? People know they won't be going anywhere because those owners live in
there.
the neighborhood that they serve.
You have an investment there.
Exactly.
Right? And it's something about you being a part of, like, I don't even know how to grow anything, right? But I'm trying to like, but I just think about like that first thing, or even my 7-year-old, right? He brought this little plant home, and just that excitement that I'm gonna get to see that, right? It's that ownership, like this belongs to me. That brings a different kind of, right? I don't know, vibe to the whole area. So we talk about that community identity. It's like, this is ours. Like, we're invested in it, and it's gonna work, right? It's gonna be successful because we're all invested. We are part of it. We've been able to create it. So it's just, it feels so good.
It's in our bloodline. You know, we take it back to Africa. That's what we were doing. We were growing our own yams and plants. And, you know, before we had grocery stores, we were growing it ourselves. And it's scientifically proven if you put your hands in soil, right, you feel better. You feel more grounded. You know, you feel more whole. So it's, you know, there's so much opportunity in, you know, investing in this area of work.
And that all I think about, and I know this is probably not a question, but you talk about that feeling whole, feeling grounded. We think about that mental wellness for all of us, right? Eating better, feeling better, being a part of community. Like, that's all that creating a healthy community, right? That's being the healthiest county. So all those things and how we connect the dots. I love it. I love it. What resources currently exist for residents who have lost their neighborhood grocery stores, or they live in an area that had never had a grocery to get access to fresh food? So what options do we have out there? Want to talk about some of the?
Yeah. So there, through this process, I've gotten to know some of the food pantries, and there's a really comprehensive food pantry network. So we're talking like future state and building, and we are going to do that. Immediately, though, there are food pantries throughout Milwaukee County on kind of every corner of the county that are accessible. You can find something every day that you're able to go and visit and pick up food. So that's kind of the immediate resource. And then I do think it's worth it to make sure, I know you talked about grocery stores that have left, but just to check in with your benefits and make sure that, I don't know if we're going to talk about the food share changes at all, and I don't want to bog down this conversation with that, but just to make sure that people are up to date with what the requirements are for that, and that they're making sure that that they have that so that they can go. Food pantries are always there.
Yeah, and I think just shouting out, COG Center, we have benefit specialists here, right? So if you don't know where to go, you don't know where the food pantries are, you can also call 211. But here, you can come in here, you can apply for benefits, you can check your benefits, right? You can get connected to resources. And so we want to also be that bridge, right? To make sure we're also supporting, you, Chairwoman, the County Board of Supervisors, because I know constituents are coming to you every single day. And as Emily talked about, there's going to be so many changes with both food share and Medicaid that's about to happen, that people are going to be wondering, where do I go? Right? And we need to be here to make sure that we can help navigate this situation, because there's going to be so many things to happen. And our priority is to make sure people have food. I think when you talk about food as healthcare, I totally agree with you. Like, people need to be able to have, that's a basic need.
It is a basic
like, why are we
need.
even questioning that? Like, so those, I don't know if you have thoughts around that, but like, how do we make sure we get people connected? And I know, again, MACF, they're doing
amazing. They're doing so much work on this issue. It's incredible to see, and I would encourage anyone to go and visit. Go to their landing page, Metcalf Park Community Bridges. They're partnering with folks like us, City of Milwaukee, Northwestern Mutual, Hunger Task Force. They're really locked in to the pulse of the community and what they need. And they're distributing not only perishable food, but also non-perishable food. So they have in their offices right now, they call it the fridge network. So folks can drop off food and donate, but people can also pick it up. So they can go and they get a shopping cart, and then go pick up chicken. They can go pick up vegetables, fresh produce, dry goods, even diapers if they have children.
That's amazing.
Right? They're partnering with Trickle Bee Cafe, so you can go into Trickle Bee Cafe. They also have one of those fridges for them, so they're also putting them in other areas of the community if folks can't get right to their office. And then they're also building out these systems, so they have the Food Justice Collective. This is an opportunity for folks to go and plan around what more they can do immediately, in the immediate, to impact access to food. So that's just a little bit of what they're doing.
Well, I saw some of their agenda. I mean, they're so organized and they have so many partners and they are about bringing people together.
Yes.
I'm like,
Yes.
wow.
From all walks of life.
Yes.
You'll see a little bit of everybody.
Yeah, and
in
it's their
those
community,
rooms.
but they're coming up with solutions for the entire
Exactly.
county, right? It's not like it's
Exactly.
like, yes, we have an immediate need here, but how do we be solution focused to think
Yes.
about what do we do across
Yes.
the county? Which I absolutely and I, have you been able to attend a couple of those
Yes.
meetings, right? Just
Yeah.
talk about your experience.
Oh my
at
gosh,
those.
they're yes, they run really good meetings, and intentionally at the top of every meeting, my favorite part, they intentionally bring the whole room together because it is a very diverse room with professionals from government, academia, community members, nonprofit folks. So it's just a room where I think most people don't sit in rooms that diverse most of the time.
Right.
And so there's a focus at the top of every meeting on coming together around the purpose, and then going through kind of what the updates are and what are we going to do together,
Yes.
and then brainstorming. They really are bringing people together around this
Yeah.
issue and successfully making an impact. I think
Yes.
they're a great leader in this space.
Yes, they've been, again, driving policy. So a lot of the policy we're driving at Milwaukee County is through this collective, which is amazing because, again, it goes back to that community first model, what the city is doing. So Milwaukee County was the first to declare food apartheid, and then the city follows suit.
Yeah.
And they're also putting their money where their mouth is, and they're thinking about how do they do business with individuals who want to come into communities and open grocery stores and being more intentional around the requirements and the expectations around that. And I'm just so proud of them and the work that they're doing. And they're not the only ones.
Yeah.
There's so many others, but I would just be remiss if I didn't acknowledge how incredible Melody and Danelle and the team at Metcalf have been, because I think they're one of the first communities to be impacted. So, like so wholly by those stores just leaving with no notice and people going hungry and needing access to food.
And
so
being
I'm so
the
proud of them.
and being the voice, right? Sometimes you just
Yes.
need that one person that has the courage,
Yes.
right, to
Oh,
speak.
yeah.
Oh, she has
There she has
courage.
the courage.
I love her. I love her. Like she
Yeah.
has that courage to just
Yes.
speak up and not
Yes.
afraid. Like, listen,
Yes.
this is what's happening, and we have to do something different.
Yes.
And getting people to listen.
Yeah, getting people to listen.
And you listen. I mean,
Oh,
you
yeah.
listen and just show that action. That's my thing. Like some people always talk about government. We slow, we do this, but I'm telling you, for this, I was like, whoa, this is moving fast. Right? we were moving. I love it, right? And so, like, being the first, I was excited to be just a part of it,
Yes.
right? Didn't need even recognition, but like seeing the community say, this is what we need, and then we like, yep, we got this.
and
right?
thank you.
Yeah. Thank the
so
team too. I mean,
critical.
David, Emily,
Yes,
like the whole
yes.
team. Everybody was like,
Yes.
our contracts team. They was like, how do we figure this out? And I had people
They
like
figured it out.
stand
So
up.
quickly.
Yes.
I think that was the fastest we've ever done contracting. It was
Yes.
amazing.
But it showed like people understood the need.
Yes.
They understood like this wasn't something that we could just take our time and right. It was like, no, this is urgent.
Right.
Right. When you talk about food and getting it to
Critical.
children,
Yes.
we're getting it to older adults,
Yes.
we're getting it to the most vulnerable.
Yes.
Like we all saw ourselves.
Yes.
We all saw our families, our
Yes.
grandmothers, our children in
Yes.
that, right?
Yes.
So I think we all just like, let's show up, let's
Let's
do it.
do
Yeah,
it.
let's
Let's
do
do
it. Let's
it.
get it
Let's
done.
do
And we
it.
got it done.
But you-
right?
my
And we still have so
gosh.
much work. I'm like so excited. We've been looking for more grants to think about how do we work across, right, with our partners to figure out how do we do more, right?
Absolutely.
So that's our ultimate goal. We're going to keep you
Yeah.
updated on that. But like
Yes.
we want to do more. So I
Yes.
appreciate
It's
your
so
work
exciting.
there.
Of course.
So in May of this year, you also, y'all been doing a lot of work. Y'all been busy, right? Adopted the resolution to create a city-county task force to bring
Yes.
together local government, community organizations, youth leaders, labor, resources, all the things, small business owners, and food justice advocates to develop actionable recommendations to improve food access across jurisdictions.
Right.
Can you give us an update on where this work is at today? And you can also give us some background, because I mean, this I was like, okay, we got us a city county task force going up. So tell us a little bit about it and where we are today.
Yeah, so I'll give you a background. So again, in a lot of these conversations around what can we do around the food access crisis, we allocated funds, but that was sort of like a rapid response. And it solved an immediate crisis. But we wanted to think about the long-term and sustainability of this work. I believe government exists, and my unique role as a legislator to embed policy in what we do is no other person on the street can pass a policy. right, but a legislator.
Right.
And by passing policy, we can institutionalize the work that we want to do and achieve. And the task force, which brings together all those people you mentioned, from youth to food justice advocates, academia, labor, et cetera, anyone who has a unique lens on this issue, it means that we can embed in government the work that we want to do, so that when I go, I won't be here forever. When our amazing county executive, David Crowley, leaves, when Shakita, when you're ready to retire, that this work can be ongoing. Yeah. And I think that's a unique role that government has. I also believe we have a unique responsibility to bring community into the halls of government. When I was first elected, I'm a school teacher by trade, so I didn't know about county government. I didn't really know about the structure of it, how to navigate it. And if I had trouble navigating it, imagine, someone who's working 3 jobs trying to make ends meet. So I also wanted an opportunity for our residents to be able to interface in the government process, to get that empowerment and that confidence around advocating for what they need with their local legislators, and then help, again, institutionalize that work for the long term.
Yeah. I was just at a conference, and I put this on there, something I've been reflecting on. And when you talked about that, the work that you're when you leave and what's going to be there, are those the things, because it says, do things that's going to be hard for the next person to undo, right? So when you think about that, what would be that? And this question wasn't on there, but I know you've already thought about this, because you're doing so much work, and it's all about the community, because you're from the community, right? And I think that's the best leaders. You and the county executive both, you're from Milwaukee County, you've been in the community, you know what some of those issues are. Right. So if you think about something that you're leading now, what would be something that you like, I want to make sure this happens, and it's going to be I'm going to embed it. I'm going to embed it in the county, and it's going to be hard for the next leader or the chairwoman or chairman to come in and undo.
Yeah. I honestly, I think it would be this work. Okay. Because I feel like it hits at the intersection of so much what we already try to impact. Yeah. Whether it's the the health of our county, the economic impact of eradicating poverty, improving health or education disparities. Yeah. I feel like it hits at so much the intersection of what we want to accomplish as a community. Yeah. And Milwaukee County is so uniquely situated to do this type of work. I've learned about local governments all across the state, and you have cities, and you have towns, and you have villages, and you have boards. But Milwaukee County, we're the arm of the state, and we have our Health and Human Services arm. We're the quality of life government jurisdiction. And so I feel like if I'm not doing it, if we're not doing it, then it's not going to get done. And I want to make sure that when I'm long gone, not only did we build an ecosystem where people can thrive in and have access to that fresh and healthy food, but we are also able to lift those health outcomes. We were able to get our children better educated, right? We're able to get more jobs and more local businesses, built in our communities, and our parks, all the things, that make a healthy community. We were able to impact that work. And I just think about the shoulders of the people that I stand on, and we think about the late greats. Val Phillips is one of my all-time. Like, she's the woman who I'm like, oh, that's who I want to be. That's who I want to implement or sort of like follow. And what she was doing, I don't think she knew that she wouldn't get to see the outcome of, but she did it anyway. Yeah. And so when I think about what I'm doing every day, it's not about what I get to see. That's right. But that I plant the seeds. That's right. And that keeps me moving every day.
I love that. Yeah. Yes. You're going to get to see some of it, though.
Oh, yeah. I hope so.
Yeah, you'll get to see some of it. So just one last question as we reflect today. I want to ask you both, what gives you hope for the future as far as addressing food insecurity in our community, food apartheid? You talk about that being intentional of, when we think about divestment. And you can talk about, the food apartheid piece, but anything. What gives you hope? What gives you hope around this?
Oh, my gosh. You touched on a lot of it. It's how brave the community has been, how loud they have been, and how engaging and community-oriented they've done this work. there was just an event that I just got back from Baltimore, so I missed it. But there is an event that was held this past Saturday and in Metcalf Park.
Okay.
And it was about bringing community together in order to talk about this work, but also learn about gardening. They had some music involved, spoken word. It was all about grounding themselves. It was all about centering, their mental health.
Yeah.
And when I think about what my community has been through, over the history of this country, it can so easily discourage you and demotivate you because it's just so hard to wrap your head around how poorly, our community has been treated from, slavery, the being enslaved to still being oppressed in less obvious ways. We're almost gaslighted to a degree. Yeah. And we have leadership at the national level that is not being kind to the challenges and issues that our communities are facing. And the rapid response of, having to constantly work against the explicit and sometimes implicit, but the explicit disenfranchisement that's happening every single day in the year of 2026.
Yeah.
But the fact that people are standing up every single day, with joy, right? It gives me so much hope because it shows me that no matter what we've been through, no matter what we're going through, we know what we want, we know where we're going, and we're going to fight to get there. And that gives me so much hope every day.
Yeah, me too. Me too. What about you, Emily? What gives you hope?
I mean, I think, there's so much energy around this. The energy is inspiring and unifying. And I think that this is an issue that lots of people can get around, even if you're not living in Metcalf Park. It's something that people are, for example, that people are rallying around and coming together on. And it gives me hope because I think we are seeing that what's good for one is good for all. And we're seeing that in action here. So that gives me hope.
Chairwoman, before we end, people are going to be asking, okay, you all did the city county task force. What are the next steps? How do we get involved? What do we do? And we may not have all the details, but if you want to tell the community as they listen, what are going to be the next steps for us to get involved and can inform them about what we're going to do next with it?
Yes. So Milwaukee County, we passed our portion of the resolution. We're working with Alderman Stamper at the city of Milwaukee to, he's drafting his resolution. We have, again, unique jurisdictions, so they have to be sort of uniquely written for the roles and the different staffing and that sort of thing. So they're drafting their resolution. And then we've been working together to create a process for a transparent process.
Absolutely.
For people who want to be a part of this work. So we'll be launching that eventually, and then we want folks to tap in. Yeah. Let us know you want to be involved.
Right.
And then I would say, just because you're not a part of that task force doesn't mean that you don't get to be a part of the work.
That's right.
The great thing about this task force is that it's now institutionalized again in our governments.
Yeah.
And how we do meetings is anyone can join those meetings. Yes. They can listen in, they can testify, they can share their opinions. And I think that's critical to the work is because it allows more voices to come to the table.
Absolutely. So, and I know you was like, okay, Shakita, we need a form where people can apply, can be you are all about the transparency. I want people to be able to put their name in there. I want something. So we're going to be working together to create that process. And once that process is finalized, we'll get that out there and communicate that with the community. But I mean, you've been really clear about community led. When you say community led, you're not playing. Some people say the words, and that's my thing. I feel like with you and the county exec, both of you are leaders who it's just not the words. I'm about the action, right? We can have all these things on this paper, but it's the action. And you truly model that.
I appreciate
that. I mean, this is not, people oh, you just say, I just want to say this. She didn't pay me for this, right? No, really, the work that you do is truly the action. And I'm so honored. I'm so honored to have our strategic director here and has been helping us to really do this work, right? Jumped in and wasn't all a part of her role, but she's like, I can do it, I'm ready, right? So I just want to thank you. Thank you for joining us today. Our amazing chairwoman, Chairwoman Nicholson-Bovell, for modeling what it means to truly allow the community to lead and to lead with action, to help give them the voice, to be courageous, right? And you even being courageous, right? And standing up to say, I'm going to stand for this because I know what it is and what it means to be a part of this community. Yes. And you know that if we address the disparities, if we address it and make sure that people have their basic needs met, that is better for all of us, that we all can truly be in the healthiest county in Wisconsin. So I want to thank you both for joining us to address this issue of food insecurity and food apartheid, and how do we get people connected, and the amazing work that I'm going to get to see you lead, right? Yeah. And you get to see all the work that you do, because it is together that we truly will create a healthy community. Thank you both for joining me today.
Thank you. Appreciate you.